Hi, my name is Dr. John Wessling, and I would like to talk to you about sciatic and leg pain. Sciatic is a pain or a burning sensation or even a numbness or tingling from irritation to the sciatic nerve. Now, sciatic pain is typically felt from the lower back that is felt to behind the thigh that radiates down to below the knee to the outer part of the leg to down here to the bottom part of the foot. Now, the sciatic nerve is the largest nerve in our body. Now, here I have a plastic model of the lower back. These are the vertebrae right into here, the bones. Between here are the discs. We have here the nerves. And over here on this side, we actually have a bulging disc that is putting pressure on this nerve. Now, while sciatica is most commonly a result of a bulging disc or even a herniated disc in the lower back, that actually compresses the nerve and causes irritation, there are other irritations that can cause sciatic pain that can reproduce the symptoms of sciatic, such as narrowing of the spinal canal called spinal stenosis, bone spurs caused by arthritis, or even pinched nerves caused by an injury. Now, another cause of sciatica may be from a condition called the piriformis syndrome. Now, the piriformis muscle is located right in through here. And the sciatic nerve, as we see here, runs through the layers of these muscles here in the hip and in the buttocks and goes into the deeper muscles of the back of the thigh. So when these muscles into here become shorter and tight, and when you try to stretch or bend, it can compress and irritate the sciatic nerve, causing you to have increased pain. Now, one of the major causes of sciatic that I have found is this area right here called the cerebellum, which is in the back part of the brain into here. Now, the cerebellum basically controls three things. It controls our balance and coordinated movement, it controls eye movement, and it also controls all of our postural spinal muscles, okay, which is very important when it comes to sciatic. So when the cerebellum here isn't functioning or working properly, or it isn't doing what it's supposed to be doing, these muscles here into the lower back and hip will lock up and spasm, which will cause the spinal muscles to lock up, creating a little motion. And the only way the spinal joints get nutrients into these disc spaces down into here is through motion. So if there is little or no motion in these spinal joints, and there's a lot of tightness and tension in the muscles, when you go to bend or move, there will be considerable binding or torque put upon these discs into here, which will then start the disc to bulge and then to herniate. And if it isn't addressed in time, they will start to wear down or degenerate, causing arthritis, irritating the nerve going down the back of your leg, and that's why you have sciatic. Now, the confusing thing about sciatica is that just about anything that irritates the lower back can cause sciatic pain. Spinal joints, nerve roots, the disc, or even the muscles can cause pain that looks and feels like sciatic. This is why so many treatments for sciatic fail. Many sciatic sufferers have tried muscle relaxers, physical therapy, exercise, and even injections with little or no help. Now, we take a different approach to the treatment of sciatic. We offer a unique sciatic pain relief program whereby, first of all, we identify the cause by doing a thorough neurological examination to determine which part of your nervous system is not functioning properly. Now, remember, as I said earlier, in many cases of sciatic patients, we may find a malfunctioning cerebellum here to be at fault. If we find that we can help you, we offer a comprehensive treatment for fast results by using brain-based therapy to get your brain and nervous system functioning properly again. We may also do spinal decompression to decompress the nerves and to rehabilitate your disc. We may do active rehabilitative maneuvers, which is designed to effectively transition you from a previously painful range of motion to one that is completely and totally pain-free. Now, the last thing we do is we examine you for any metabolic or hormonal imbalances that may be contributing to your lower back and sciatic condition. So often there are chemical and inflammatory causes to sciatic pain. Laboratory and clinical testing, including urine and saliva, is done to determine your underlying metabolic state. So, the key to successfully treating sciatic pain is to restore function to your body in the form of therapy to your brain and nervous system, then correcting your metabolic imbalances, and also rehabilitating your disc and muscles to minimize your chances of a relapse. Now, if you suffer from lower back and sciatic pain and would like to learn more about our unique therapeutic approach, then at the bottom of this page you'll find an area to fill out for more information. We will then send you an online link to a video that will explain all the different treatments that we do, which makes our care so unique and successful.